My name's Eric Buch. I'm the Professor of Health Policy and Management at the University of Pretoria. So the National Health Insurance System is part of the overarching strategy to achieve universal access to quality health care for all South Africans and to overcome the reality that one of our most defining features of our health system is its inequity. And so within that context, a number of national health insurance pilot districts were established across the country as a way of moving forward towards that realization. Up until now, the NHI pilots have been receiving additional funds, and those funds have been going into strengthening those district health systems. So improving the equipment and the staffing and a number of other innovations like e-management and improved district health planning. So from those districts, we've learned that if you invest some additional resources and support, you can start to strengthen the public health system. But what we haven't learned enough about is the possibilities of alternative models of how we procure those services, who contracts who, how we pay for the services and what payment options we're going to use, different governance models such as district health authorities being contracted into the NHI. And we talk in a health system about how you pool your money, who purchases the services, how they're paid for, such as by capitation or diagnostic relations groups, and who actually is the provider of those services. And in any national health insurance system, you can have different mixes of those different options. And what we need to do is we need to learn what works best and will work best for South Africa. And so what I'm encouraging is a second phase of national health insurance piloting, which tests out alternative models and options for the delivery of health care within a national health insurance model. So I'm a strong supporter of what I call phase one, or the health system strengthening phase of the NHI pilot districts, and I think that needs to be extended, and they need to become more creative and innovative in those improvements in the health system, which is starting to come through from what is called an ideal clinic project. But I also think there needs to now be a second fund for a second phase of testing new models for the national health insurance system as we go forward.